Hi there. Hi everyone. I'm just adjusting the camera here. My weekly live stream. This is actually going to be the final one, wrap up, final Q&A. I'm just going to give a minute for people to kind of join. I just have to show my poor cat. He's so sad right now. Look at him. He's looking longingly outside. Can't let him outside right now. I'm gonna let him outside in a second when I'm done with this live stream. So let me start off with some questions that came up in when I asked what kind of remaining questions people have about grief and or trauma, in particular trauma and PTSD. So one question was, is overcoming trauma similar to overcoming grief, where you can get real acceptance but find yourself experiencing sadness or anger 10 years later? Like, after going through exposure therapy, would it be normal to continue experiencing PTSD symptoms, flashbacks, feeling agitated, etc.? So let me separate the different types of emotions that someone can have after trauma response, because the idea is that after doing therapy, some of the emotions get weaker. Some may actually get stronger, like appropriately stronger, but then over time, you want to reach a point of acceptance where more often than not, you're not glad it happened to you, but you see it as part of your life story. Now, that doesn't mean it's not going to come back in various forms of, say, feeling sad when reminded of something, years later. But it's the global experience a person has is no longer colored by their PTSD. So, for example, specifically fear and anxiety. That is always what we're working on in therapy to go down. We're trying to accommodate to the fear that gets triggered when someone's reminded of their trauma. So that always should go down with treatment and really not come back except for just maybe a little bit here and there. What can become stronger emotions, though, as someone's processing trauma are things like anger, if someone wronged you or hurt you, sadness, if you lost someone. Temporarily, people may find kind of guilt or shame coming up as they work through, maybe they were in war and hurt someone else and feel bad about it, or sometimes people who were victims of assaults feel guilty, like they did something to deserve it. So those are things that may temporarily go up, but then we want to work through it and process it so that it goes down. Sometimes strong emotions like disgust, and that might go up as someone's talking about their trauma, but then we want it to go down. The two emotions that I would say can be healthy if they linger are sadness and anger, because it can be really infuriating when bad things happen to us, especially if someone else does them, and it can be sad that bad things happen to us. So the idea is not that you stop feeling kind of any negative emotion related to the trauma, but that those emotions get weaker and it moves away from fear, agitation, fight or flight to a more healthy appropriate expression of sadness or anger. Okay, next question. What is your recommendation for people who feel like they know they need help but feel overwhelmed and confused about where to start? So I talked a little bit about in the last video, the practicalities of where you can find a therapist who does prolonged exposure therapy, but let me just talk a little bit about the process of finding a therapist from an emotional perspective, because often people get really overwhelmed where, oh God, I just went on my insurance site or I Googled people and there's this list of people and I have no idea how to choose. So an interesting study, and this has been studied in a couple different ways, the largest predictor of how someone benefits in any kind of therapeutic relationship or in therapy is not the credentials of the doctor or the therapist, although you want someone with a basic level of competency, but how much you like the person. And it kind of makes sense, right? Because if you like the person and you trust them and then you believe they can help you, then you're going to be open to the process and you're going to get more out of it rather than being kind of closed off and defensive. And that's the most important thing when you're getting help for trauma, or really anything, but particularly trauma, is you want to feel like you trust the person who's teaching you the process, and that you trust the process and that it makes sense to you. And so as I've been talking over this last month or so about prolonged exposure, this idea of you need to face your fears to overcome them, if that makes sense to you as I'm saying it, then that process is probably going to be helpful for you. And if you're searching on your own for an individual therapist, like, trial and error is okay. Don't just stick with the first person you see if you don't like them. It's totally appropriate to see someone for some kind of like test run sessions. I'm never offended if someone wants to, just have a conversation on the phone with me, but doesn't feel it's a right fit and doesn't want to follow up, or does a couple sessions but is looking for a different approach. So I can just tell you, as a therapist, psychiatrist, you're not offending the person. It's really about a mutual good fit. And so don't be afraid to kind of test out some people. And yes, they should have good credentials. They should be competent. I mean, that's like the cost of admission. But don't feel, but that's necessary but not sufficient, okay? So if someone has the greatest credentials in the world, but you just it's like talking to a brick wall, or you just don't feel like you can open up, it's not gonna be a good fit. And it kind of brings me to, I wanted to kind of, as a wrap-up, talk a little bit about the course I created, which I introduced, I think, at the end of the last live stream, which is, because treating PTSD is something that's so, I feel like, widely misunderstood, and so many people are suffering and don't understand or know that there's this very specific type of treatment that works. And, even when I get emails from people like, oh, can I see you? And I can't because of time, or because I'm in a different state, and I'm only licensed in California. And I'm sending them kind of these links, but I know that ultimately it's a challenging process to find someone, that trial and error process, that just not that many people are trained in exposure therapies. And so inevitably, you can find those people, but you have to be a little bit savvy and kind of know how to work the system and make phone calls and all that, and work kind of the insurance coverage. So I really feel passionate about kind of getting the information out there. So I took really everything I know about trauma from the therapy perspective, the prolonged exposure perspective, and put it into a protocol of video modules where it takes you through the entire process. So, and currently, if you go into my profile, I don't know if you can look at my Instagram profile while watching this, but in my link tree, it should be at the top, is a link to the information page for the course, and you can purchase it there if you want. And it's only going to be live for an hour after I end this Instagram live, because I want to kind of do like a beta test and just take kind of a small number of people in. But you can go there now if you want to and see information about the course and what it covers. But it goes over, one, what is PTSD? There's a lot of misunderstanding about even what the symptoms are. And so a lot of people have it and don't identify that is what they're having. And so specifically the feeling numb, feeling detached, not feeling depressed, but not necessarily feeling joy, feeling like your world is small. Those symptoms people often don't realize are like part of PTSD, and that the avoidance is not necessarily that you're agoraphobic and just stay at home all day, but that when a thought pops into your brain about the trauma, you suppress it, and how that kind of suppresses positive emotions too. So, and then I go over why some people get PTSD and others don't, which is an interesting question. I mean, I'm sometimes amazed at people who've gone through horrible traumas and do not have PTSD. That kind of is amazing to me. But there are various reasons in terms of biological predisposition, early life experiences, other recent stressors that kind of, when you add them together, it can make someone more sensitive to, say, a traumatic event leading to PTSD. And when people understand that, it kind of helps explain it for them, and there's less self-blame when you see, oh, wow, there's this checklist of things that that makes sense that I would have developed PTSD. And I'm in that category. I have a lot of the check boxes, like highly conscientious, perfectionistic, sometimes anxious, there's pros to being that way, but then there's cons where a person like me and you maybe are more sensitive to our environment, and in a wonderful way sometimes in terms of being intuitive, but in like a painful, emotionally painful way sometimes. So then I go over like in incredible detail the protocol, how you can do it on yourself. And I don't necessarily recommend everyone do it for themselves. Like you might want to also be working with a therapist, but there's not enough therapists to do it for everyone who has it, to be honest. And it's also like can be really expensive. Not a lot of therapists are accepting insurance to have this training. I mean, I would honestly say probably like very, very few. So the course is meant to kind of be a much more cost-effective way. It's like more than a book, but less than doing 6 months of hour-long sessions weekly, which is what I did, and it adds up, paying out of pocket for it. And I include all of the exact same handouts and worksheets that I use with my one-on-one patients. So how do you create an exposure hierarchy of like the order in which you're going to do your exposures? How do you do in real life in vivo exposures where say, hey, I'm avoiding this situation. Okay, I'm going to make a little program to go out and face this fear. And how do you track if it's working or not? There's questionnaires I give patients before, during, and after both the individual exposures, but then like at the beginning of treatment, in the middle, at the end. And it really helps people when they can see, oh wait, my anxiety number was 15 before, now it's 3. It kind of puts an objective number to what is a subjective experience, but it's nice to see like, oh, I made this improvement. I also talk about specifically complex PTSD, and this is an additional module of, the differences between regular, I'm never sure what the adjective to use is, typical PTSD and complex, and how you might want to modify the protocol if you have complex PTSD, because adding in some additional processes can make it a more effective treatment for you. And then I talk about how you can, if you want to work with a therapist in parallel to what you're doing with the course, with the protocol, how you can do that. And then I included something that's a bonus, which is I have not talked in great detail about in these Instagram lives, which is relaxation and mindfulness meditation techniques specifically for anxiety. A huge misunderstanding is that my meditation is a relaxation technique. It is not. Actually, for people with anxiety and trauma, it's actually makes you feel pretty bad when you sit down to meditate, because at least at first, because you're exposed to how insane your brain is, and it's like, oh my God, this is my brain, I can't handle this. But what I realized actually through personal experience, I've done a lot of meditation. It's that long, 7-day silent retreats and stuff like that, and actually I'm trained to teach meditation, mindfulness meditation from UCLA's Mindful Awareness Research Center, is that meditation is actually an exposure exercise itself. And when you frame it that way, it's okay that it kind of feels bad at first or feels like a little stressful at first, because then what happens is that you can face your own mind and have it not be scary. And it doesn't take that long to get to that point. I would say within a couple of weeks of a very specific type of mindfulness meditation practice, you can get to the point where, oh my gosh, my mind is a safe place for me to exist now. I don't have to distract myself with the TV being on all the time or on social media or whatever. So I go over something that I haven't seen elsewhere, and this is like the bonus in the course, is these separate modules of these, how to integrate these relaxation and separately mindfulness meditation practices. And what I haven't seen out there before is specifically for anxiety, why mindfulness meditation, awareness, insight, and meditation can be useful in the case of anxiety and trauma. So, like, I'm gonna kind of wrap up. What is the point of doing some sort of protocol or program for PTSD, whether it's my course or seeing a therapist? Because it's hard, you feel worse before you feel better type of situation. Why not just not do it? What I tell patients who are kind of on the fence when I explain to them the therapy and they're like, that sounds hard, is ask them, well, is what you're doing now working for you? Like, if you project forward a year, 5 years, 10 years, the rest of your life, decades, would you feel good to look back and say, oh, I just kept doing the same thing and I kept feeling the same way? I mean, if the answer is yes, then great. But if the answer is no, then yes, it may feel intolerable to face your fear, but it's probably more intolerable, the idea of not, and going the rest of your life not experiencing joy as much as you could, not experiencing meaning as much as you could, and fulfillment. And I remember particularly for myself when I was recovering from cancer the first time, and it was like around a year and a half after I finished chemo. So I was on chemo for 3 years, and then a year and a half after that, I mostly physically recovered from the chemo, but then I still was not myself. And at that point, I really had to recognize that my limitations were no longer physical, they were emotional. And they were limiting me more than, say, the physical fatigue I had felt, or the, like chronic pain and other physical symptoms. The physical part of it actually inhibited me from having a good life less than the emotional part. And when I got treatment for my PTSD and did this protocol, my life opened up. And unfortunately, I relapsed 3 months after that. So I only got a brief period of time. But I'm less than a year and a half, a little over a year and a half from my stem cell transplant, and I'm like jet setting. I got my vaccine from COVID, so I just traveled to Florida. I went snowboarding in Vail. I'm going on these trips that I would not have done prior, not because of physical energy, but kind of fear of I can't handle that. Snowboarding, I never thought I would snowboard again. And it was this mental block of that was pre-cancer. I can't do that. And I did it for the first time since having cancer the first time. That was a kind of a confusing sentence. First time in 8 years. And it was because I addressed not just the physical aspect of my recovery, but the emotional. I'm going to end with a quote from Nietzsche, not to be kind of one of those people, but it just really, I think of this quote all the time, which is, he who has a why to live can survive almost anyhow. And I'll just repeat it. He or she who has a why to live can survive almost anyhow. Meaning that whatever difficulties one faces, and I know that I faced with cancer, if you have a reason to live that's strong enough, then you can get through it. It's not life difficulties that hold us back. It's our inability to find purpose in face of our difficulties. And by addressing kind of the fear, the social isolation, the emotional restriction that goes with PTSD, you are removing the biggest boulder in your metaphorical river that's blocking the flow of water, right? There's a dam, and if you get that dam down, your body and your mind will know how to do the rest to create meaning in your life. It's not like you have to force yourself and make a list of, I want to learn French and I want to whatever. You just need to get yourself feeling well and remove these blocks, and you're going to know what your purpose is. And I don't know, to me, life is too short to not use every day to execute your purpose. So I'm going to end there. if you're interested, check out the link in my link tree to the info page of the course, and you can purchase it if you want. I have a limited time offer, and I don't mean like artificially limited time, like buy now, but I'm offering to a small number of people the option to upgrade when you buy the course, to have a personalized assessment from me. What that means, it's not that I'm not gonna do like a medical care with you, but I'm going to have you fill out some detailed questionnaires that I'm going to analyze and then help create the specific protocol for you of, hey, these are the memories you should face. This is the order you should do it. Here's how you track your progress. And I'll record a video for you kind of going over the whole process. And it's limited because I can only do that for so many people in terms of the hours I have available. So that link is going to be live on my Instagram profile for just an hour because I'm kind of beta testing. I will put it back up at some point, but if this sounds really interesting to you, I would check it out now, or else you might have to wait like some period of time. I don't know, a few weeks, something like that. So I hope you've enjoyed this series I've done on trauma. I hope it's whether you get treatment or not, or do my course or not, it's at least informed you on kind of how you can have a happier life. And have a great evening, and I'll see you soon. Bye.